Our next speaker is Dr. Euahna Varigos, and she's going to be talking about using photons to disrupt pain. So Euahna is a specialist anaesthetist and world-leading practitioner in the field of laser therapy for pain management. So she's previously studied medical acupuncture in China and Melbourne, and she's been in private practice for over 20 years, and that's involved a lot of her work is around treatment of patients with a wide variety of chronic pain conditions.
Thank you, Carly, and thank you for inviting me to speak. First of all, I'd like to have an idea of who is medical in the audience, who knows anything about photons, laser therapy, few, and acupuncture. Right. Okay. My talk is going to be very non-scientific. I actually thought that I would talk about how I treat patients and how I've evolved into being where I am, because it's one of the main... I'm always asked, how come you're an anaesthetist doing what you're doing? Because there isn't anyone else really doing that. Now, let me just work this one out. Press the right one. Yeah. So, disrupting pain with photons. And initially I was going to call this unravelling pain with photons, but I decided disrupting was a stronger word. And also the other word I was going to use is light, the forgotten energy. And we're talking about things that have been forgotten. And in fact, we've said it already. Cannabis, and you've said the oxygen, the hyperbaric, how long ago it was being used. But one of the common themes here is that there's not much money to be made out of oxygen or really cannabis, yeah. So, and there's no money to be made out of light, nor is there with a huge amount of money to be made out of laser, really, photons. And there's a struggle in our medical, against the medical establishment and the drug companies. So that's off my chest, I feel better. And I think everyone agrees, yes, that's why we're here. And I have no interests that have been... Now, I put this up because, as I said, everyone asks me, how are you doing this when I'm treating them, because I'm not using drugs, I'm using all these other sort of adjuncts to help them. And where is the light? Is that... Oh, here. So I'll go through this, but this was the main thing. In 1994, I decided to move out of theatre. I had 3 young children and I wanted to go into pain medicine. And I went to the pain clinics and it was just morphine, MS Contin, pouring this into people, and I just could not face myself to do that. So my brother is a professor of dermatology actually, and I was talking to him, and this is exactly what happened. So we talk about how you get moved into different things. I was saying I want to move into pain management. I don't want, give anaesthetics anymore. But I can't write drugs, prescribe drugs. And I have even thought of acupuncture, and that was because a few friends had mentioned it. I knew nothing about acupuncture, absolutely nothing. And my brother, who is very scientific, professor and at the Walter and Eliza, good idea, he said. And literally, I was in hospital and I literally went out and phoned the GP, because it was done with the GPs. And that's how I ended up moving from here, which I would have been, the anaesthetist up here. And if I hadn't done acupuncture, I would have been the typical interventionalist anaesthetist. But in fact, I didn't. I did this. And when I did this, I was up the road with Benny Fu. Don't know whether people know Benny Fu, but Benny was one of the examiners for my medical acupuncture. He actually did medicine with my father. And he said, Euahna, you don't have rooms. And I said, no. And he said, would you like to come and work in my rooms? So that meant I ended up learning about all this other stuff, nutrition and integrative and that was the beginning of that. So I had this other arm. And laser, Benny had, in 1996, had a physics I'm not going to get past slide one. Someone from Adelaide talking about laser therapy, okay? And that was in 1996. It was very ahead. And so we did a laser therapy course. So I did a laser therapy course in 1996, and I did I did my fellowship in medical acupuncture in 95. So all this happened very quickly. Then I did all these other things, and then over this period here, I'm talking because I work with surgeons. Yeah, I work with chronic pain, obviously, but my main interest is working with surgeons to prevent acute pain post-operatively and then improve people's outcomes so they don't develop chronic pain. Anyway, that's taken a bit longer than I expected. So we'll whip through, and I think this is an important slide. The challenge in medicine is to choose the best treatment for our patients at the right time. Just because something hasn't worked before doesn't mean it mightn't work at another stage. And not just different drugs, because when I go to these meetings, it's all multimodal medicine, it's all just different drugs. That's all they talk about. And I keep on saying, hello, David, the Dean of Anaesthesia, you know what I do, and I've been telling you about these results. Oh, yes, I suppose you could be in that little bit there. It's just the same sort of story. Anyway, the tree of knowledge. This is another little thing. I took this photo the other day because I do believe that we have lost common sense and judgment in medicine, and it's all protocol-driven, and protocol is not always the right way to go with our patients. And so I'm not a protocol-driven doctor. Yeah. I look at how I can help them with my knowledge base, which is a bit wider than most anaesthetists. So light. Is light the forgotten energy? Well, somehow we have forgotten, because look at this here. This is in the end of Second World War. We started using light for jaundiced babies. And the dermatologists do. Oh, sorry, I'm flicking when I'm supposed to be pointing. This is the seasonal affective disorder. That's sort of now coming to the fore, that we can use light. And melatonin. Most people understand about melatonin, and it comes from our eyes near the optic nerve. There's another nerve that actually senses the light, and ends up going to the suprachiasmatic nucleus, which is this there in the brain, and then when darkness falls, the melatonin's released so that we sleep. All this happens normally, and photons are light. So photons are able to be utilised in our body as light. And it's just these wavelengths that we know, certain wavelengths of light can be absorbed. We'll get on to that. Anyway, we'll go quickly through this. And that's just, everyone knows that, but Michael Cousins, an anaesthetist who I actually mentioned when I was doing a lot of medical acupuncture, that we should be looking at another way, and he just turned around and said, I only believe in scientific evidence, drugs, in other words, and walked. Chronic pain epidemic, and yes, we have a chronic pain epidemic, and I put this here because anaesthetists, we are a bit to blame, because we send patients home on these huge amount of drugs, and we're flooding our society with OxyContin. One of the reasons is because people have to leave hospital earlier after operations, and that's an economical thing. But that means that when I was a student and a resident, we used to make sure patients were well controlled with their pain before they went home. But now they just get sent home and they don't know what to do. Patients just are given everything, because in hospitals, that's the other thing. I work with patients in hospital and I'm treating to reduce pain, and the nurses come in and give all the regular medication, and they give all the PRN, which is only if you need it. So the patients are not really informed about how to manage their pain. But there is, I have to say, my college, the Anaesthetic College, is addressing this for the first time just recently. Now, I have to say this because of Greeks. I'm of Greek heritage, and I want to say that the ancient Greeks, Aristotle, emotion imbalance of vital fluids, emotion, and all this sort of stuff. Homer wrote that opium back in 800 BC, to soothe his pain and forget his worries. It's always, and the emotion here with Aristotle was in the heart, not the brain. And then nothing much happened until this guy, the French guy, René, and he said, well, yes, there is this nerve going to the brain. And then that was when we understood that the brain was important. And then the other big time was with gate control theory, Melzack and Waugh. I don't know whether everyone knows that, but it was an important change in our idea of how to treat pain. And it also was the beginning of us understanding endorphins, our own morphine that we have, and also that the inhibition at the spinal cord level. And the common thing that we do when we get hurt, we rub where we're hurt, or you rub the mother will rub where the child has been injured. It's a natural thing to set up this inhibition. Now the latest thing is here, functional MRIs. So I think this is the important thing with respect to the emotion that we said right at the beginning with Aristotle. This is the visual input, which is a separate one, but just here, people with chronic pain, if you stimulate an area like the knee, you'll get the area in the knee in the brain will light up to say, yes, that's pain in the knee. However, there is equally as strong a light up of the frontal cortex with chronic pain patients. And this is the history of pain, their previous experience, emotion, and memory. So memory and the previous experience perpetuates the pain that chronic pain people have. Their perception of pain is because of that. Well, it includes that. Now, pain just quickly. Acute pain happens, all these things happen, and it's all normal that we get the nervous system is activated, there's a motor and autonomic nervous reflexes, but this is to protect an area that's been injured. What happens and this is the soup, every time I go to a meeting, there's a new neurochemical a new receptor discovered, and I do remember that, for a long time, the drug company or whoever was being sponsored would say, yes, we're looking at this new drug, and this will be the drug. And it's only recently that I have to say someone did go up and say, we will never find one drug. But it's taken a long time of me looking at going to meetings to hear that. And we won't, because this is an old slide. It's just every time it just gets larger. And then the other thing is I realised that if we have these neurochemicals, receptors, we actually have these chemicals in us. And in 5 minutes, my goodness, okay. And so we actually have the neurochemicals. So we're a chemical factory. So how can we stimulate the chemical factory? So we'll go past this. This is embedded. Our chronic pain is when the acute phase becomes embedded, so that basically an acute thing that's normal doesn't recover well. And some people are prone to that. We don't know why, but there is susceptibility, and acute pain that isn't managed well will lead on to chronic pain. Now I'm going to get on to, and this is the other part again, with respect to the emotion and the catastrophizing patient. They do worse in acute pain post-operatively. So again, emotion is a very strong fueling of pain. And we'll go through sleep deprivation. So everyone knows that. These are all the things. I explain this in depth to my patients. And the distressed patient. And then we have, why don't we reboot? If we could reboot the brain, we would get rid of a lot of these little glitches. And I tell patients are happy that I'm not trying to do that. And then this is just the idea that I was saying before, that we actually have all the drugs ourselves, and we put the exogenous drugs in and have a whole lot of side effects. But if we could just increase our endogenous neurochemicals that keep us in harmonious fabric, we would. And the question is there a way of increasing this to unravel embedded pain signals? Resynchronization or reprogramming. And that's where I see photobiomodulation. And photobiomodulation is low level. This is how I use it, with low level laser, LED, light emitting diodes, and laser stimulation of acupuncture points, because I was introduced to laser acupuncture when I studied. And photons, so light, has an effect on cells, and it has a physiological effect. Okay, so this is light onto cells to have an effect. And this is the main thing. Every cell in our body has a photon receptor, just like you were talking about the carbanoids. You know, every cell, not just our skin, every single cell. So if you can get light or photons too, and I should have brought my my laser up, you will have an effect. Okay, and we talked about how long ago, 1903, he won the Nobel Prize, and it said here, whereby he has opened a new avenue for medical science, where we're still waiting. You know, it's a long, like your, yeah, it's, and this is just that story, but I want to just say that here, NASA, they were the ones that started a lot of it rolling, because they were looking at what they had to do. These are the institutes that are doing a lot of work and a lot of research, all very strong institutes, you'd agree. Laser acupuncture is the use to light, and I won't go into that, but I use light to stimulate acupuncture points, and this was started by these eminent pioneering physicians, including the director of anaesthesia at Panch. And then we won't, the only thing I'd like to say is that this woman, Jacqueline Filshy here, a lot of work on how acupuncture works neurophysiologically. So I use laser acupuncture to get the neurophysiological effect, and then I use photons as well locally. But photons have a systemic effect, because when you use laser, you're helping blood cells, which circulate. So it's a systemic effect. That's why they're finding people with Parkinson's do better with laser when they're being treated. And there's a lot of research about Parkinson and dementia coming. That's just going through the acupuncture neurophysiology and why we use these points, why these are the strong ones. It makes common sense, really. This is the laser that I have, one of them. And that's a very complicated, but what I want to say is non-thermal. This is light, this is laser with low energy, and that we have endogenous chromophores or light receptors. And so long as you can get the light to the tissue, you will have an effect. And one of the there's a window of that, window of what light goes through. But the big thing is that if you can just see here, the light receptors are on the mitochondria. Now, do people know? Yeah, the mitochondria is the powerhouse of the cell, so it increases oxygen utilisation in the cell. So this is an important slide in that it upregulates cell function. And that means equal to anti-inflammatories, but normalises cell function, has an anti-inflammatory effect, decreases swelling in front of your eyes, improves wound healing, lots of studies there, decreases pain, analgesic effect on peripheral nerves, upregulates cell function, and modulates the peripheral neural transmission. So this explains how photons can have a role in disrupting pain. And I was going to talk about when, earlier the better. You improve sleep, you calm the nervous system, you calm people down. And that's part of the acupuncture effect as well, because I know in fact, I have surgeons who send me patients say, oh, she'll desensitise your nervous system. That's what they say. And so that's what I do. And then I use the photons in the area. So I just will go through this, and less is best, a bit the same. Less is best, it's a biphasic response. Can't take back what you've already given, and everyone's different on that curve. Oh yes, I was just going to show that you can see the difference there. This is a patient that was after 45 minutes. So you can see that and she had CRPS. And in fact, I didn't treat that hand, I treated the other side, which is what I do, contralateral treatment. And then the only thing I do want to say is they're the lasers I use. I just want to say one thing about Rod Dalziel. Does anyone remember the name Rod Dalziel? Orthopaedic surgeon? Anyway, he was the only surgeon who's really had the trouble to look at what I was doing pre-op and post-op. And when I treated a couple of his patients, he was retiring a year later, but for that last year of his work, he said, "Euahna, you're treating everyone because there's such a difference in the post-op analgesic requirements, and the patients are just clearer and better post-operatively." So he's the only one who's done a true multimodal approach. Pain is complex, the acute to chronic, the embedded. Every cell in our body has a photoreceptor. Photons of specific wavelengths and dose act on photoreceptors. They increasing oxygen to cells to normalise the function of cells everywhere. And it's red and near infrared light. Less is best. Titration is important. Thank you.